My name is Colleen Markel, and I have been in the nursing profession for 25 years, and happily so. I am currently getting my DNP and have a project that I'm excited to talk to you about. So my DNP project is implementing a nursing mentorship program as a tool to increase nursing engagement, as well as increase graduation rates, as well as increase patient satisfaction scores. In 2010, the Institute of Medicine, in conjunction with the Robert Wood Johnson Foundation, came out with a groundbreaking report. And that report was called The Future of Nursing, Leading Change, Advancing Health. And it really was an initiative calling nurses to reform their profession, become more involved in leadership, make connections with other colleagues and other professions, as well as transform the care that we give at the bedside. That patient care at the bedside has become even more complex, and a lot more equipment, a lot more that's being called upon us. So we know that in order to meet those patient needs with other leaders, and we need to become more involved in leadership ourselves. One way in which we can do that is with a mentorship program. The mentorship program is a 6-month program that encourages peer-to-peer mentorship. So what do I mean by that? So this isn't a preceptorship. This is not career coaching. This is a peer, either working on the same floor that you are or another inpatient setting, in which this person has gone back to get their BSN and has valuable information for you. So my mentorship program for my DNP project is targeted at nurses that are returning for their BSN. So they're heeding that call of leadership, and they're trying to advance their degree. And as we know, there's a lot of variables that are involved with advancing your degree, right? There's navigating tuition reimbursement if you work for an employer, applying for grants or scholarships, and as well as how do I do this when I have a family and I have a full-time job? So there's time constraints too. And as well as, is there differentiation with pay? I mean, we go back to school and we do get advanced degrees, and does your organization support that? Support it not only financially, but support it with flexible scheduling, giving time for you to meet with your mentor. Can you participate at the place where I work? We have a REACH program, which is a clinical ladder program in which those that are returning for their advanced degree, whether it's a BSN or an MSN or your terminal degree in nursing, you are able to participate in that, and there are financial incentives that go along with that. So I think that for organizational support, we have to also look for what can we do to support ourselves, and that's reaching out. And the peer program that I am implementing involves pairing nurses that are going back to school with others that have gone back to school, and even more of a pair that the mentor that you would be paired with that person has gone to the same college that you are going to. That can't always happen, but ideally that's what I would like to happen. So I realize that the matching process is so important in a successful mentoring relationship. As you know, a preceptor relationship is typically during your orientation or for the clinical rotations that you've completed in college. Coaching is a little bit different as well from mentoring, because mentoring is a 6-month commitment and it is wide ranging. So topics such as communication, conflict management, resiliency, skills at the bedside, as well as mentoring you on school assignments, topics that you may want to research that are relevant to where you work. There are so many things that a mentor can share his or her expertise, that it is just a program that is part of that organizational support, but it is a program that is meant to help you be successful. Because going back to school is difficult for any of us. The other important piece are patient outcomes, right? We're in nursing because we love taking care of patients. We make a difference at the bedside. There is no doubt about that. But when I'm talking about patient outcomes and patient satisfaction, the research has demonstrated those with a BSN degree decrease surgical site infections, Foley catheter related infections, pressure ulcers, the incidence of med errors, as well as readmission rates, decreasing length of stay, even decreasing C. diff prevalence. There's all kinds of patient outcomes that can be affected by having an advanced degree. For all of us that have gone back to school for an advanced degree, it changes the way you think and the way that you problem solve as you're exposed to more information and more research. Patients are given a survey. On that survey, they're asking all kinds of questions related to their care. What was the teamwork like? Did the physician and nurse communicate well? What was the noise level? Was your pain taken care of? Was your pain addressed? When patients and their families feel as if they've received great care and they have had their needs met, of course, they're going to put a better score, as that score is compared to scores all across the nation. And so whichever institution that you work for, they are measuring patient satisfaction scores. The mentorship program can impact patient satisfaction scores if we have nurses that are well prepared and they are willing to share their knowledge and expertise with others. It only increases the teamwork, cohesiveness of the team, and our overall communication with the patient and their family, as they always have so many questions and concerns when they're here. Currently, there is only one state, the state of New York, that has RN to BSN laws. So they are requiring nurses to be back in school within X number of years, as well as grandfathering some that have been in the profession. Other states have tried but have not been successful. My study is in a Midwestern town in Michigan, and we do not have a state law that requires nurses to go back to school, but many organizations have a requirement, and this is nationwide. We want our patient outcomes to be the best that they can be. We want nurses to be empowered to seek leadership roles. And we want overall cohesiveness at our institution. As you know, physicians are highly educated. Respiratory therapy is moving to a bachelor's degree. Physical therapy is a doctorate degree. Occupational therapy is a master's degree. Nursing is the only one that is still at an associate degree. And I argue that point to just say, who spends the most time at the bedside with our patients? It is the nurse. So we have a little catch up to do in academic preparation. So the return on investment for hospitals really includes patient satisfaction scores, which translates into dollars, patient outcomes that are improved, and so huge reimbursement dollars or awards from the Centers for Medicaid and Medicare for meeting those metrics. And of course, we're compared to every other hospital in the United States, so there's only a certain amount of dollars, and the best performing hospitals will receive more of those dollars. So of course we want to provide the best care possible, but it provides, when we get the maximum amount of reimbursement, it provides for better staffing opportunities because we have the dollars to do that. We have the dollars to purchase equipment that will only help us provide better care, offer more services to our patient. As a nurse getting a higher degree, we have increased job satisfaction. We have improved retention. When fellow nurses or leave the hospital, that leaves opening. Others have to pick up more of the extra work. And so if we can retain our nurses, giving them as much support as possible, it will increase their engagement as well as improve retention. The mentorship program that I'm proposing has several pieces to it. So we would begin by establishing that pair, that mentor and mentee. And it's a volunteer program for 6 months. With it, that initial meeting will include the partnership agreement in which the mentor and mentee mutually decide upon the goals. And the goals can be different for each person depending on where they're at in school or where they're at in their career. The mentorship program should be mutually beneficial for each one. And the mentor can gain leadership skills. The mentee can gain that knowledge and expertise from their mentor, but as well gain leadership skills on their way to become a BSN. There will be several e-learning modules for you to take. And what's great about the e-learning modules is they pertain to resilience and organization, timekeeping, and conflict resolution, and communication, and all of us could probably take e-learning modules and learn something from them. These are directed specifically for the mentor and mentee to help you, not only for the mentors to problem solve with their mentee, but for mentees to know that these are the issues that I can talk through, that I can bring up to my mentor, and we can work through those together. There will be 10 to 15-minute meetings that will be required every 2 weeks for the mentor and mentee to meet to discuss goals, to discuss any problems that the mentee would like to talk through with his mentor, as well as talk about school assignments. So that there will be agenda items for each of those bi-weekly meetings. At the very end of the 6 months, we will do a celebration, because it is a time to celebrate. After you've completed that 6 months, you've had some growth. Hopefully you are almost graduated or well on your way to graduation, so there's a lot to celebrate. And then lastly, there will be evaluations. So there will be a midterm evaluation as well as a final evaluation to get your thoughts on how the mentorship relationship has really worked for you. The important thing is, for my project, whether the feedback is good or bad, I'm looking for constructive feedback that will only make this program even better. The pilot program will be in 2021 and with hopes of sustainability, and of course my results will be published. I want to thank everyone for taking the time to listen about my mentorship program. There will be links at the bottom for you to participate, so please click on those to become a mentor or mentee.